Hello friends, I welcome all you to this pharma family. Today in this video we are going to focus on the topics of hormonal regulation of female reproductive cycle and different phases of female reproductive cycle. First, coming into the first topic, hormonal regulation of the female reproductive system. We all know that GnRH, that is gonadotropin releasing hormone, which is secreted by the hypothalamus, it will controls the ovaries and uterine cycle. You can see in the below image that this gonadotropin releasing hormone will stimulates and will release the follicle stimulating hormone and luteinizing hormone, that is FSH and LH, from the anterior pituitary. This FSH initiates this follicular growth, while LH will stimulate the further development of these ovarian follicles. In addition to this, both FSH and LH will stimulate the ovarian follicles to secrete the estrogens. The LH will stimulate these theca cells of developing follicle to produce these androgens. Under this influence of this FSH, the androgens will be taken up by the granulosa cells of the follicle, and then they can be converted into the estrogens. At the mid of the cycle, this LH will triggers the ovulation and then promotes the formation of corpus luteum. The reason for this name of luteinizing hormone is that corpus luteum. By stimulating this LH, the corpus luteum will produce and secrete estrogens and progesterone, relaxin and inhibitin. These are the four different types of hormones that will be regulated: estrogen, progesterone, relaxin and inhibitin. At least 6 different estrogens will be isolated from the plasma of the human females actually, but only 3 are present in significant quantities, that is estradiol, estrone and estriol. In a non-pregnant woman, the most abundant estrogen is estradiol, which is synthesized from the cholesterol of the ovaries. These estrogens will be secreted by the ovarian follicles, which have several important functions. First, coming to the some of the important functions that are regulated by the estrogens. The first one, the estrogens will promote the development and maintenance of the female reproductive structures, that is secondary sexual characters and the breast growth. The secondary sexual characters will include the distribution of adipose tissue in the breast, abdomen, mons pubis and hips, and the voice, pitch and even a broad pelvis and some other pattern of hair growth on the head and the body. And this estrogen will also increase the protein anabolism, which including the building of strong bones. And this regarding of estrogens are synergetic with the human growth hormone, that is HGH. And some of the other functions that include estrogens can lower the blood cholesterol levels, which is probably the reason that women under age of 15 will have a much lower risk of CAD, that is coronary artery disease, than do men of comparable age. These modern levels of estrogens in the blood will inhibit both the release of GnRH by the hypothalamus and the secretion of LH and FSH by the anterior pituitary. And coming to the second hormone functions, that is progesterone. This progesterone will be secreted mainly by the cells of corpus luteum, and they can cooperate with estrogens to prepare and maintain the endometrium for the implantation of a fertilized ovum and to prepare the mammary glands for milk secretion. This high levels of progesterone also inhibits the secretion of GnRH and LH. The small quantity of relaxin, which is produced by the corpus luteum during each monthly cycle, relaxes the uterus by inhibiting the contractions of myometrium. This implantation of a fertilized ovum will occur more readable in a quiet uterus. During the pregnancy, the placenta produces much more relaxin and it can be continued to relax the uterine smooth muscles. At the end of the pregnancy, this relaxin hormone will also increase the flexibility of the pubic symphysis and may help in dilating the uterine cervix, both of which is delivery of the baby. And the fourth one is inhibin. Inhibin is secreted by granulosa cells of growing follicles by the corpus luteum after ovulation. It inhibits the secretion of FSH and to lesser extent of LH. Next, moving to the second topic, that is the phases of female reproductive system. It involves a different phases. The duration of actual female reproductive cycle will be typically ranges from almost 24 to 36 days. And this we are going to duration of 28 days, and we are dividing this cycle into 4 phases. The first one is menstrual phase, second one pre-ovulatory phase, ovulation and the post-ovulatory phase. The first phase is the menstrual phase. The menstrual phase is also called as menstruation or menses even, lasts for about almost the first 5 days of the cycle. And this the events in these ovaries will under the influence of this FSH, several primordial follicles will develop into the primary follicles and then into the secondary follicles. This developmental process may take several months to occur even. Therefore, a follicle that begins to develop at the beginning of a particular menstrual cycle may not reach the maturity and ovulation until several menstrual cycles later. And coming to the second phase, that is the pre-ovulatory phase. The pre-ovulatory phase is the time between the end of menstruation and the ovulation. The pre-ovulatory phase of the cycle is more variable in length than the other phases, which account for more of differences in the length of the cycle. It lasts from almost 6 to 13 in a 28-day cycle. Normally, the one dominant secondary follicle will become mature as graphene follicle, which continue to enlarge until it is more than 20 in diameter and is ready for ovulation. With reference to this ovarian cycle, the menstrual and the pre-ovulatory phases together will be termed as follicular phase. Keep in mind that the menstrual and the pre-ovulatory phases together will be termed as follicular phase. And coming to the third phase, that is the ovulation. Ovulation means the rupture of the mature graphene follicle and the release of secondary oocyte into the pelvic cavity usually occurs on a day 14 in the 28-day cycle. During this ovulation, the secondary oocyte will remain surrounded by its zona pellucida and corona radiata. The high levels of estrogen during the last part of pre-ovulatory phase exert a positive feedback efforts on the cells that can secrete the LH and gonadotropin releasing hormone, and this can cause ovulation as the different follows. And this high concentration of this estrogen will stimulate more frequent when compared to the release of GnRH from the hypothalamus. It is also directly stimulated this gonadotropins in the anterior pituitary to secrete this luteinizing hormone. This GnRH will promote the release of FSH additionally by LH by anterior pituitary. And coming to this time to do, an oocyte will be lost in the pelvic cavity, but where it later get disintegrated. The small amount of this blood that sometimes leaks into the pelvic cavity from the ruptured follicle can cause pain called as Mittler's. That is at the time of ovulation. That is called as Mittel's merge. An over-the-counter home test can detect this rising level of LH can be used to predict the ovulation a day in advance. And coming to the other phase, that is the post ovulatory phase, which is the final phase. The post ovulatory phase of the female reproductive cycle is the time between the ovulation and the onset of the next menses. And the duration, it is the most constant part of the female reproductive cycle. It lasts for almost 14 in a day 28-day cycle from day 15 to day 28. After the ovulation, this mature follicle will collapses and the basement membrane from the granulosa cells and then theca cells interna will break down. On once the blood clot forms from the minor bleeding of the ruptured follicle, the follicle will become the corpus hemographic, and then it is the theca internal cells mix with the granulosa cells and then they will become transferred into the corpus luteum. This is the fourth phase which we are covering with the post ovulatory phase. I think in this video we have covered the hormonal regulation of female reproductive system. We discussed about the four hormones, that is the estrogen, progesterone, relaxin and the inhibin. These are the four hormones that help in regulating the secretions and the physiological effects of estrogen, progesterone, relaxin and inhibin in the female reproductive cycle. And in the next second topic, that is the phases of reproductive cycle, we are focusing on four different phases, that is the menstrual phase, pre-ovulatory phase and ovulation and the post-ovulatory phase. I think this video will help you a lot, and if you like this video, please like, comment and subscribe to my channel, that is Pharma Family.